it's Eva Cartman, and you're listening to the Dream Big podcast show, the place to go to learn, laugh, and grow. Today we welcome nationally renowned pediatrician Dr. Jen Trachtenberg. This is episode 75, Big Dreamers. You ready? It's time to dream big.
Welcome to the Dream Big podcast show. We're inspiring you to shoot for the moon, take aim and go. We bring to you amazing guests who truly love what they do. Every day they're living their dreams, and so can you. Dream big, take action to reach your goals. Are you pumped yet? It's showtime, let's rock and roll.
Welcome to the Dream Big podcast show. I am your host, Eva Cartman. And today, I'd like to start by telling you about a special gift we have for all you big dreamers. We created a super cool Dream Big journal that we want to ship to you. And get this, the front of the journal has an illustration of an astronaut in outer space. What is so amazing is that the journal is printed and personalized with your own face and name. So you'll see your face on the cover of this journal as an astronaut. Oh, and it's free. Parents, please go to dreambigpodcast.com to claim your free personalized Dream Big journal while this offer is still available. You'll see a video of my mom and I showing our journals. Go to dreambigpodcast.com to get your free journal. I want to give a quick shout out to the review of the week. This is from Johnny and reads, I love the Dream Big podcast. We listen with our kiddos on the way to school and whenever we are doing road trips. The whole family gets inspired to dream big. Keep the great episodes coming. Thank you, Johnny, for your review, and we will definitely keep the episodes coming. Big dreamers, can you do us a favor and please keep the reviews coming? We love to read them, and it helps us stay at the top of the charts in iTunes. It's time for you also to enjoy our interview with Dr. Jen Trachtenberg. Dr. Jen is a nationally renowned parenting expert, board-certified pediatrician, and fellow of the American Academy of Pediatrics. We learned so many fascinating facts about her career as a pediatrician, including how she calms kids who are terrified of shots. As always, we have show notes at dreambigpodcast.com/75, where we will include links to Dr. Jen's website and everything we discuss in the interview. Without further ado, here's our interview with Dr. Jen Trachtenberg. Let's roll the tape. Hi.
Hi, how are you?
Good. Welcome to the Dream Big podcast.
Well, I'm so excited to be here and to meet with you.
We're so happy you joined us, Dr. Jen.
Dr. Jen.
Thank you.
Let's start at the beginning. When did you know you wanted to be a doctor?
Well, I actually wanted to be a doctor since I was a little girl, actually your age. I just was really interested in science and biology, the body and how it works, and really taking care of people. I don't even have any doctors in my family. I'm the first one, and it was just something that I was always passionate about from being a young child.
Oh, my sister is actually 2 years old, and she loves to play doctor also. She loves to play doctor, and she has a stethoscope, and she just goes around every night and checks all our hearts and our dog Annie's heart.
Well, that's such a great thing. I actually tell my patients that, pretend play is really important in young children, but also to get them used to it. So I have them practice at home like you're doing with your family and have them bring their kit in. And so it makes the appointment more enjoyable and less scary for the children as well, too.
I remember, Eva, when you were growing up, you pretended to be animal doctor.
I did?
Yes.
Oh.
You love the animals, so maybe you'll grow up. And that's what you said. You said they're going to grow up and be a veterinarian.
Yeah, and you ultimately decided to be a pediatrician, which is a doctor that specializes in caring for kids. I was wondering, why did you choose that particular specialty?
So when I went to medical school, I really didn't know what kind of doctor I wanted to be. And I tried all the different specialties, and pediatrics really was the best fit for me. I love taking care of children and watching them grow. I get to take care of the kids from newborn, being just first born, all through young adulthood, and help them to grow. And really, they start as this like healthy, clean slate, right? And then I can help them to build these healthy habits to improve their long-term health. And I also like the aspect of not only working with the kids, but also working with mom and dads and parents together, helping them raise healthy children too. So it was this great combination that I actually get as a pediatrician to work with parents as well as to work with children too. So I feel very fortunate.
I can tell it's very important because every time we take our kids to the doctor, it does help when pediatrician is actually educating us about a lot of things, because a lot of times we as parents, we don't know what's happening, right? What's best for our child. So it does help when it's not like only you curing something, but you also educating how to prevent things.
Yeah.
So important. I mean, that's really, I agree. That's really sort of what I feel I specialize in. I call it like health and wellness, really keeping those habits healthy and how to do them and continue on into adulthood. And this way we can really prevent a lot of chronic diseases by really learning and keeping up healthy nutrition, exercise. And again, there's so much information out there. And so one of the things I do like to do, as you said, is speak with parents and really educate them so they can make really educational and they can make the best choices that's possible for their families.
And I know that for sure later in our interview, we're going to be talking about the educational part that you incorporated, Dr. Jen, in your practice, and now millions of people getting benefit of that. But we will get back to that in a little bit. I know now you have many, many questions that have to do with your career and actually helping our young listeners, young big dreamers, to maybe understand, like, what do they need to do if they choose to be a doctor one day? What do you like about doctors, Eva?
Well, I like that they always kind of comfort you before they give you like a shot or something. And I was wondering, what do you say or do to kids who are like maybe crying or just not cooperating because they're scared of having maybe a shot or having their throat checked or something else?
Sure. So that's such a great question, Eve. I really appreciate you asking me that. And I actually was speaking on my video show about that the other day. So one of the things that's really good about going to your pediatrician is to build a rapport, which means sort of a good back and forth, that they really trust you and what you're saying. So I really work on, even before there's a shots or anything like that, my patients trusting me that when what I say is truthful. So if they are going to get a shot, I don't say, no, it's not going to hurt at all. I tell them, it might be a little prick, and I sometimes show them what it would feel like with my finger, with the pressure on their arm, so that they'll know ahead of time. And they come to believe what I'm saying and trust me. I also talk with parents as well, too, because that's a big part of it. If parents play into the kids getting really upset and there's usually like a lot of anxiety and stress firsthand about getting the shot. So sometimes just talking about it, telling exactly what's going to happen, but then sitting the child on the parent's lap, giving them a big hug, and just doing it quickly, 1, 2, 3, after it was explained. Inevitably, most of the children are so happy that it's done with, that it was done quickly. They usually say, Dr. Jen, that wasn't so bad. And I said, I know, it was just the anticipation of it was going, in your head, you built it up that it was going to be so painful, and it really wasn't. So after this encounter, normally what I do is I take a picture. We may take a selfie together, and then on it we write, this was not too bad. Remember for next year. Mm-hmm. And I think that goes a long way. And parents and the kids usually like it too. And then they really feel proud of themselves that they were able to get through this. And obviously it was for a really important reason.
That's really innovative. I never seen any doctor taking selfies with their patients.
I know. And that was obviously a very specific question for doctors, but Dr. Jen's advice is something that you can apply in your everyday life when you are really scared of something or trying to calm a friend down who's overreacting. And like you said, that when kids have shots, before they just overreact and they're scared, but then after they just say, "Oh, that wasn't so bad." I know they're scared, but afterwards they want to remember that it wasn't so bad.
That's true.
Exactly.
And you know you're going to get it, so you might as well get it over with.
You are so smart. I totally agree with you. Exactly.
And for our listeners, I would like to mention as well the reason why we're asking Dr. Jen all these interesting questions, because she's not an ordinary doctor. She's not only seeing patients one-on-one in her office like usually doctors do, but Dr. Jen, I know that you meet with them outside of the office, and you actually have a following on social media as well. And something that I already mentioned before, educational videos. Can you tell us a little bit more about it?
Sure. Well, I have two different educational things that I do online. One of them is called What's Up Wednesday, which I actually did this morning. It's at 1 p.m. Eastern. And really, I talk on Facebook about common parenting questions, like how to stay healthy during the flu season. This week, I did a series on what's that cough, because coughs are so common, and also questions on sleeping and feeding, anything that parents have, or even relevant things that are in the news, because there's so much information out there that parents often get overwhelmed. There's a lot of anxiety and stress. Am I doing the right thing? Am I doing something that may hurt my baby? So I try to allay their fears, be very reassuring, and give them that information that they may be able to get at lunchtime, or they can watch it anytime that they want. And that's Facebook Live. You can just follow me on Dr. Jen Trachtenberg on Facebook. But I also, really interesting, I'm really proud of this new endeavor. It's called Pediatrician in Your Pocket. And what that is, it's the first really all-inclusive, all-in-one tool for parents. It's a video parenting guide manual. So, instead of all those books that you read or you don't read or sitting on your coffee table, this is a video parenting guide that's broken down into small 5-10 minute segments on every parenting question that you may have or may not even know that you have. And it's really geared for new parents, for those that have children from newborns through age 2. And again, all your sleep questions, all the most common questions I get from my parents in my practice, and the advice that I give them, as well as the advice that I give to my children as well too, on nutrition and sleeping, developmental questions, what to expect, what games and activities to do with your children, as well as, again, what you can do to keep your child healthy, and to prevent chronic diseases, as well as parenting advice, just like we talked about with the shots, or also preventing tantrums. So you name it, just so much information, and parents can have it at their fingertips on their phone 24/7. So it's sort of like having a doctor on call when you need it most.
That's great.
Oh.
And how can our audience find more about it, Dr. Jen? Is it an app, or it's
so it's a video. Yeah, so right now it's a video series that you can download straight to your phone. The easiest way is just to go to my website, which is drjen.com, dr-jen.com. And right there on the homepage, you'll see a link for Pediatrician in My Pocket, Pediatrician in Your Pocket, excuse me. And actually, just for your listeners, there is a great discount code, PIP50, PIP50. Yeah, so anyone who's listening, they can get a big discount on Pediatrician in Your Pocket. So just go to my website, which is drjen.com.
That's awesome. And we'll include all the links in our show notes, of course, as well. And it's a really, really great idea because I remember when Eva was born, she was the first one. I was a new mom. I was 27. I didn't know where to go, what to do. And, quite frankly, you don't want to go to the doctor every time you have a question.
Exactly.
You might pile up all the bills. And I was single mom. Like, I didn't want to go too often. And if I had that guide in my pocket, just regular questions. She has tummy problems, or she's,
right.
All of this stuff. So that's
right. And it can even and it can even help you, like you said, tummy problems. And I'll go through the common list of things that may occur and what you can do for it. But also, like, when it is necessary, look, this is probably a time that you should go see the doctor. Mm-hmm. So I'm not trying to be be your doctor, but giving you the information that you need so you can make those right informed decisions. And I agree with you. Some people don't even have such good access to medical care and to pediatricians. But like you said, sometimes you just have a quick question, or maybe it's on potty training, or maybe it's which foods to give my baby. You could just have this, while your child is sleeping, you can check out the video at night. And this way you have everything. It's a complete extensive set, as opposed to Dr. Google. You don't know who you're going to get. You don't know if they really have the credentials, because almost anyone now, as you know, right, in this age of technology, almost anyone can say they're an expert and have followers, and people may not really be getting the parenting or the pediatric information that they need that is really based on evidence and science.
Thank you, Dr. Jen.
Yeah.
Thank you for sharing. Now, Eva has burning question about the
Sure.
food and nutrition that she wanted to ask for herself and for our listeners, of course.
Great.
Yeah, because before you mentioned about healthy foods, and I've just reached most kids' favorite subject, vegetables. I was
Do you eat
wondering-
vegetables?
Yeah, I eat mostly carrots and cucumbers.
That
But-
took us a long way to get to even that point.
Yeah.
That's okay.
But I was wondering why veggies are so important.
So there are many reasons why veggies are really important. First of all, they have lots of vitamins and minerals that are so important for your body and to function well. But they also have a lot of fiber in them. And fiber is really important for many, many reasons. Fiber helps things move along through your intestines so you don't get constipation or problems going to the bathroom or pooping, as we say in pediatrics. Also it helps to keep you regular. And so that's one of the most important things, fiber, but also all the different nutrients that are in fruits and vegetables too. It's not only just getting the nutrients, say the vitamin C or even other antioxidants, which are also important that are help with to boost your immunity as well too. But it's the combination. So it's always good to try, new things. As you get older, you may feel like trying more. I always tell parents, have the different fruits and the veggies available, and you'll see. Maybe your friends will start eating like raw peppers, and they're of the different varieties, red and green, orange, and maybe you may like them with different dips or salad dressings. And you'll start to experiment yourself. But I just tell parents, try to put them out there and have them. And when your child is ready, they will definitely try them. I saw that in my family as well too. So I practice that when I preach. And as they get older, and like you said, you've added cucumbers and carrots, and I bet even next year, there'll even be something else new that you added too.
Yeah, I was just going to say that we progressed in that direction slowly but surely. And Eva before ate only carrots and cucumbers. Now she added tomatoes, right?
Oh,
Excellent.
I
Different-
love tomatoes.
All sorts of, and before she's like,
Tomato.
saying, "Oh, tomatoes, no way." And my younger one, who's two and a half now, she was such a good eater when she was born, and after she started
I was
first eating
also.
solids, and then she stopped. She switched.
Yes.
She was like, "Okay, no more." And it's like,
They
"Oh
do-
no, I was hoping."
Yeah, well, she still may be. So it's very common for toddlers to get picky. They also don't grow as fast, so they don't need as much. They do get much pickier, and the amount that they need is less. So just keep on doing what you're doing. If she liked it when she's younger, then I'm telling you from all my years of experience, I've been in practice for over 2 decades, those kids will start to pick it up again later on. Just continue to have those and let them be around the home. Let them see you eating them. And I'm sure when she starts school, what have you, she'll see her friends eating them too, and it will start to pick up again. So I wouldn't worry too much. The idea for a parent is to have it available, and the children will decide when to eat them. You can't force them to eat it, but when they see the importance that we talked about, how it's great for your health, for your mind, your body, for your immune system, for your GI tract, all those important points, they will then tend to start to eat them and like them more too as they get used to them. So don't panic now. She's still quite young.
Thank you, Dr. Jen.
Yeah, and also one tip for the kids, if you like some kind of sweet or something, just pretend that vegetable is your favorite kind of sweet, and then eat it.
Or eat some fruit. Fruits are good too.
Yes.
Berries,
Exactly.
Really sweet.
That's the best way to get through fruit. Did you ever try growing any fruits or vegetables yourself at home, like tomatoes or anything?
Yeah,
That's a good one. Yes,
I
remember.
have.
I think you started eating tomatoes actually from when we started growing them.
Yeah.
Yep.
Also, I have an apple tree, which the squirrels took all the apples,
You
and
didn't get any?
we didn't get any. And I used to grow mints and some tomatoes and stuff.
Yes, that's
Wow.
a good tip. Dr. Jen, I remember she got a little
And now
bit
I grow
more
flowers.
adventurous. And I
Great.
actually sent her last year to Siberia to see my parents. This is where I'm from, and they have huge gardens.
And I was just like saying, "Oh, look, my tiny garden is amazing." And then I went to their house. Their full front yard is just
Like half acre of the garden.
Wow. I hope you took pictures.
She did.
Oh, and that's where I learned to love peas.
Yes.
See? Well, it really works because I have to say that locally grown and fresh fruits and vegetables, or even just tending to the gardens and doing it yourself, it really makes it more passionate. It makes you, want to eat and try the foods more. But definitely the fresh fruits and vegetables, they just taste so much better. If you go to a farm, right, and have strawberries, oh my goodness, my kids thought they were like candy the first time they had them from a strawberry patch because they're so sweet. So that's a tip that I tell parents all the time too. It really can be helpful.
Thank you so much. And Dr. Jen, we're also wondering, because a lot of our young big dreamers would like to be doctors maybe one day, we're wondering if they can learn a little bit more about you, about your daily routines. And I know that you are to education right now, as you mentioned about pediatrician in your pocket videos. When do you have time for all of this? Filming videos, being with the other patients, like seeing them outside, being on social media.
I know. She must be like Wonder Woman or something.
Oh my goodness. Well, I think you sound like Wonder Woman. You doing your podcast and school, my goodness. But I think one of the things is really being organized. And I think you need to prioritize. So there's only so many hours in a day. I definitely think sleep is really important. If you don't get good sleep, then you have a really hard time concentrating during the day. You can get headaches. You may not feel well. So it is important not to overextend yourself and then not sleep at night too, right? So I sort of prioritize. I know I may have a list and I may not get through everything, and that's okay. And I have 3 children of my own as well too. So obviously I have to care for them and make them dinner and get them to their activities. So it's all about, just organizing, I think, and making your priorities, in order, and not really stressing too much about getting every single thing done on your list every single day. If I can't, then it may bring to the next day, and then that will be at the top of my list. But you have to sort of prioritize what's the most important things for you to get done each and every day, and what specifically needs to happen too. And then you do have to schedule, as you probably know, time for yourself as well too, right? You need a little bit of relaxation or time to regroup and think. I like to do yoga when I have time. If not in a class, then even just a few minutes by myself, just to sort of recharge. And so, it's definitely busy, but I think raising children and helping other people to get the information so they don't have so much anxiety and stress, and to help those parents sift through all that information on the internet, it really just brings me a lot of pleasure too.
And my mom actually loves to sleep when she has free time because she doesn't get to sleep.
Right.
And she basically has 4 kids since my sister and me, my dog, and my dad kind of still acts like a kid.
That's a good quality.
Right?
Yeah, I do have 4 kids.
Yeah, and
Busy, right?
Yes. Sometimes the oldest one is the toughest.
Yes, I said there's different issues and problems and things to handle depending on what age, but there's always something, right?
Yeah, at the age of around 40, they act up a lot.
I was wondering what you are planning to do next. What's next for you?
That's a great question. Well, I think I'm going to definitely continue on with what I'm doing in the media, with Pediatrician in Your Pocket. It's going over so well now that I'm hoping then to maybe, since Pediatrician in Your Pocket is really for newborns to age 2, then to get into the toddler age and even the teens. So maybe and tweens too. So actually they can access the information themselves too. They don't even have to go and ask their parents. They can get some information from me as well too. It's all about empowering my patients, as well as now being able to spread that wealth of information to parents as well as children, so they can take ownership of their health and not be overwhelmed by all the information out there, and to have a reliable source that they can go to.
Maybe podcast one day, Dr. Jen.
I love that idea. You're going to have to teach me how to do that.
No problem. We'll give you all our secrets and strategies.
Mm-hmm.
Thank you.
So, Dr. Jen, if you go back in time and talk to your 10-year-old self, what would be the best advice?
Well, I think I would have to say, I think I was always very motivated as a child, and I always persevered on. I think it's important to know that you are going to make mistakes along the way, and not to get upset by them, to learn from them. Don't make that a barrier to things that you think you may not be able to do, to keep on pushing forward. And I try to do that, but I think it was much harder when I was younger.
Thank you.
And we have 2 last questions.
Okay.
You have already made many of your dreams a reality, but if you look at yourself today, what's your big dream for the future?
So I think there's 2 dreams I think I have, or I know I have. And as I said, one is to really continue in the momentum of what I'm doing. I know my patients, as well as the people I interact with online, really feel that I've helped them, that they have taken more charge and of their health. And it's really about, as I said, healthy habits. We know that what you do in childhood has a huge impact even as you grow up. So eating healthy now can decrease heart disease and obesity and liver disease and cancers. And there is so much that you can do. You have a lot that you're under your control. So really continue teaching people how to make those healthy habits stick is really important to me. And also, as you brought up, I have a family too. So really just continuing to make sure that my kids become as productive and healthy and happy as they can be, and watch them grow and flourish too is really important.
Dr. Jen, thank you so much for coming on our show and sharing your
Thank you.
advice. And I'm sure that a lot of our listeners, big dreamers and little big dreamers, they will get a lot of practical tips from today's interview.
Yeah, and a lot of information about what maybe to do if they want to become a doctor.
Yeah. Because
Yeah,
you
great.
can see with persistence and doctor is not only about being in the office, right? It's also about communicating with lots and lots of people. You can do that very easily. Nowadays, Dr. Jen is doing live shows from her office. That's amazing.
I know.
I actually never watched live videos from doctors, so I'm definitely going to check it out. Dr. Jen, thank you so much
Great.
for sharing. I know the power of reaching the audience that way, so that's really, really important that you're doing that.
Yeah, and we have one last question. Where can our audience find out more about you?
Sure. So the easiest way is to go to my website, which is drjen.com, dr-gen.com.
Thank you so much.
Thank
and
you.
We'll include all the links in our show notes, as we mentioned before. And for our big dreamers, little big dreamers, I would like to say that stay healthy, even during the flu season.
Yeah.
Ask for advice. Try to do everything you can to prevent disease by eating healthy, by sleeping well, by, of course, getting pediatrician in your pocket videos, because this way you can prevent a lot of things that you might not know, and you don't maybe have to go necessarily to the hospital to visit the doctor, and Dr. Jen will share with you when and how and what to do, and you can always contact her on social media and join her live shows.
Thank you, Dr. Jen, for being on our show.
Thank you for having me. I had a great time.
Have a great day.
Bye.
Bye.
You too. Bye.
Thank you, Dr. Chen, for taking time out of your very busy schedule to share all those wonderful tips about being and staying healthy. I'm sure you inspired many of our young big dreamers to dream big about a future career as a pediatrician. Be sure to check out our show notes at dreambigpodcast.com/75 for links to Dr. Jen's website and everything we discuss in the episode. When you go to the show notes, you'll see a place to sign up for our Insider newsletter, where we send exclusive content, including a free audio that I made on my top 10 tips for making and keeping great friends. This audio is only available for those who subscribe, and I know this will really help you, so please be sure to have your parents join the newsletter to get it. Thank you so much for tuning in. This is Eva Cartman reminding you that you have unlimited potential. Your dreams are not optional. You need to make them essential. So take massive action to turn those big dreams into reality. Live with passion the way life is meant to be. I'll see you in the next episode. Bye.